Hi, I'm Monica Ortiz, and you're watching the Masters of Mindfulness series. Today's guest is Dr. Randy Martin. Dr. Martin is a licensed acupuncturist. He also practices homeopathic medicine, Chinese medicine, and nutrition. Dr. Martin has studied philosophy, psychology, meditation, and Kabbalah. He is the author of 2 books. The first is Optimal Health, How to Get It, How to Keep It, and the second is No Mud, No Lotus. He has had his own unique journey with medicine and healing. Welcome to the show, Dr. Martin.
Thanks, it's great to be here.
I'm happy to have you here. I was actually reading quite a bit about you, and I find your road very, very interesting. Can you tell our viewers what brought you to the path of healing and helping others?
Well, I had some of my own health issues way back more than 30 years ago. Prior to this profession, I have a master's of urban planning, and I did environmental planning. I was trying to basically save the planet. And what I found is it was very, very stressful. And from that stress, I developed some health problems. I went to a homeopath and an acupuncturist who helped me a great deal. And that kind of instigated me looking at a new profession for myself.
Wow, wow. And what did you find when you went to the acupuncturist? Was that a new kind of concept for you?
It wasn't so new. When I was a kid, my dad used to make me take loads and loads of vitamins. So I kind of grew up with a holistic perspective on things. But I remember during one of my first acupuncture treatments, for no reason at all, I just started singing in the middle of the treatment, and it became a pretty spiritual experience for me. And I realized there was a lot more to it than just the physical ailments I was coming to be treated for.
Wow. You know, I went through acupuncture as well, but for me, growing up, I had a massive fear of needles. I didn't like needles. I was born with asthma, and so you know, being a hyper kid and then having asthma kind of doesn't mix. And so I was at the doctor's quite a bit. So in my 20s, I was suffering a lot of bronchitis, pneumonia constantly. And so my MD said, take acupuncture. And I was terrified and I didn't do it. But my next bout of bronchitis, I was done with that kind of pain and sickness. And so I went through acupuncture too. And it wasn't fun in the beginning, in the sense of getting over the fear. It was so scary for me. So actually laying down on the table and watching him come at me with needles, and then not just it be the shot and then gone. You know, they have to stay in you for a minute or two.
Yeah, usually about 30.
Yeah. So it was really scary for me, but, and that's what I meant by not fun, but understanding it, having the doctor, I sat and talked to him about it for a while, and having him explain it to me and what it was actually doing to my body and meridians and how they work, helped me. It helped me kind of get through the process. So you went through vitamins, so it wasn't so new for you, but the whole acupuncture side of it, what was your experience with it?
I guess I hated shots, but I can't remember ever having a fear of the acupuncture needles themselves. The guy I was going to, I was practicing as an environmental planner in Oregon, and I drove about an hour each time to a guy who was a medical doctor who did acupuncture. There weren't a lot of acupuncturists back then. And he was very warm and cozy and just a nice guy. I remember it was kind of odd. He sat in the room on a little child's chair below me. And I was in just a normal chair. Because he didn't want to intimidate at all. He wanted to be sure that it was an equal kind of thing.
That's brilliant.
And there was soft, relaxing music and soft lighting, and it was just a really cool experience. I used to love going there. It was very healing.
Yeah, that's amazing. You know, when I do lectures, a lot of times they want to put me up. Well, I'm tiny, first of all, but they want to put me up, and I always like to sit same eye level, stay eye level. And sometimes I'll do the same. I'll bend down a little bit, you know, so that, because I think the information that I give maybe a bit intimidating. And then sometimes I'm a bit intimidating for being so tiny. And somebody asked me earlier, you know, you talk a lot during these shows and you talk about your process and you talk about what happened to you. And I always say, because I come across as very intimidating and I don't want people to be intimidated by me. I'm just another person, just like everybody else, who's had my own story and who's had my own problems and my own health issues and had to face them kind of. Sometimes it was scary, but in my own way, you know, and letting people know that even though it's scary, you can do it too, you know.
Yeah, a lot of times my patients want to know what my diet is or what supplements I take, because they think I'm the healer. I should be healed or something. I'm like, no, I take a whole bunch of supplements every day. I have all my own issues.
I don't walk on water.
I get acupuncture. I go to a homeopath.
Yeah, and that's one of the things I talk about in this show as well. One of the shows I did before, I interviewed my PT, Alex Reyes, who I think is absolutely amazing. And just to let everybody know, like, I've had accidents, and even though I work on people, I don't always get to work on myself. And so I have to trust somebody and go to them. But I have I think I open up a very clear, honest relationship with my health practitioners. And so do you encourage that with your patients?
Yeah, my philosophy is to have an equal, kind of an egalitarian teamwork approach where we're equals.
Yes.
And we both share just as equals.
Oh, that's awesome.
And I also like to have a teamwork approach with any other practitioners that my patient is seeing, whether it's a physical therapist, a medical doctor, a chiropractor, so that all the communication is just open and equal. Nobody has a one-upman kind of thing.
I think that's a brilliant way to approach things, because I like to also the same. When somebody comes to me and I can't help them, and I know I can't help them, because I don't think medicine is a one-size-fits-all. I think that we should be able to send people other places when we know that what we're doing is not going to be, it's not going to heal them in the way that they need the healing. And so sometimes personalities don't fit. And I want somebody to feel like we just talked about being, you know, I want somebody to feel absolutely comfortable and happy, because happiness helps healing. Right?
Has to be a good fit.
So I think we should all get to know each other as practitioners. We should all get to know each other and kind of like, okay, go to Dr. Randy Martin, or go to Corinne, who we interviewed, or Alex, or Dr. Luce, or whoever. So you practice homeopathy, and so a lot of people don't know what homeopathy is, or have a different idea of what it is, because I hear some people talk about it and it's not the right idea. So I would like for you to explain it to our viewers.
So I came about homeopathy. Firstly, when I was an urban planner up in Oregon, I went to the naturopathic college up there for some health issues I was having due to the stress I was under. And I grew up as a kid having a lot of strep throats and taking a lot of antibiotics. But this student intern at the naturopathic college gave me a homeopathic remedy to get rid of my strep throat, and it worked just like that.
Oh, wow.
The interesting thing is I was also seeing an acupuncturist in Oregon who didn't know what homeopathy was.
Oh.
And I told him I was taking homeopathic mercury.
Oh, wow.
And he said, oh, no, don't take that, because it's mercury. And we all know how bad mercury in fish and this and that. And I had to explain to him, no, this is homeopathy. It doesn't even have one molecule of the substance of mercury in it. So it's perfectly safe.
Okay. And how did he feel about it after?
He was still skeptical, but I realized, you know, he was an MD who did acupuncturist. So he didn't really know about other holistic methods. So I was going to say, so then that helped my throat. And then I moved back to LA, and I was in acupuncture college, changed careers, seeing a chiropractor who gave me my second homeopathic remedy. And that was for stress-related stuff, neck pain and stress. And I suddenly started, after taking it, crying. And that was very unusual for me. I was pretty
goodness.
shut down in those days. I went back to her and I said, what did you give me? It totally opened me up emotionally.
Right.
I thought it was just for my neck pain and stress.
Wow.
And she said, you know what? I think you should see my homeopath. So I started seeing her homeopath, and then I brought him in as an instructor to my acupuncture college.
Wow.
So he became my teacher and my homeopath.
Wow.
And then that became my specialty among all the different holistic modalities that I do.
That's amazing. Oh my goodness, that's wonderful. We just talked about passing each other, passing on the patient to who we think might be a better fit, or even not a better fit per se, but somebody who can, I guess, crack the cube.
Yeah.
And just really get in there.
At different times.
Yeah,
different
absolutely.
places.
That's amazing. So your journey has been unique in that you spoke about it a little bit earlier, that you were in urban planning. And so you worked in a lot of social, environmental projects trying to save the planet. That's interesting to me because I feel like you've been either trying to heal the planet or heal people. So you've been in this.
Yeah, most people don't see the connection. To me, it was really obvious.
Yeah, and the writing's on the wall.
I wanted to do healing work.
Right.
But on the macro level, it was a little too stressful for me, dealing with the board of supervisors and the city council and the land developers and all that. So I took it more to the micro level of healing, helping to heal the individual.
Right.
And
so
it's much more rewarding, and I can kind of get my hands around it.
I connect them because I believe deep inside that if you heal the person, okay, and you bring them to consciousness, that they will, in turn, practice universal responsibility and either help others or heal the planet.
Right.
Be more aware of how they're hurting the planet.
Right.
So, yes.
That's exactly my belief, too.
Yes.
It's my hope.
My hope.
Yeah.
My eternal hope.
Yeah,
and that's one of the reasons I write my books and I do the lectures that I do, and really do the sessions that I do, and really talk to people and get them to a better state of mindset, because I do believe it. And in my experience, and I know that people out there, there's a misnomer that people can't change or people don't change. And I don't believe that, because I've seen it happen through the past 20 plus years I've been helping people. People can change if they want it. People do change if they work at it. So and the things that happen once that happens are brilliant. They're amazing.
And sometimes people come to me for neck pain, as I did my chiropractor, and the homeopathy or the acupuncture can actually open them up to a deeper level of change. I'll have patients come in and say, I came to you for neck pain or low back pain or headaches, but suddenly I'm noticing I just feel better overall, or I feel more grounded, or things are just going better in my life.
Right. Yeah.
And so it shifts the energy. Yeah.
And then do they open up about what's happening in their life then?
Oftentimes.
Yeah.
I don't want to push and force the opening.
Right.
But if they're open to it, we'll get to that place where some of the emotional and spiritual blocks will come up as a part of the treatment.
Right. And it's brilliant. Isn't it beautiful to watch?
Yeah, it's fun.
Yeah, I think so. And sometimes, I have this, this is me opening up. I have this thing that people used to say about me, and it wasn't a bad thing, and I never made it a bad thing because I never wanted to turn it into a negative, but I was the person who made people cry. Because, and people used to me, they used to say, you just need to carry a box of tissues around with you, or a bag of tissues. And it was true, though. I mean, because that opening up, like you said, when you took that medicine, and then you just started crying, which was not your norm.
And often during an acupuncture treatment, I'll come back to take the needles out, and they're full of snot and tears, because it just opens up the pathways, meridians and the pathways. Yeah.
And you just get that release.
Yeah.
And we need that. You said you were doing urban planning and you were under so much stress. And I've spoken about cortisol in other shows, but it really hurts your body.
Right.
You know, we need it for a split second when there's a fight or flight situation that happens, but then we need to know how to fix that after.
Right.
After we work through that situation, we need to stop ourselves and go, okay.
Yeah.
Let me get rid of this nonsense because and with mindfulness, it's going to hurt my body. And if I keep building it up, it's going to really hurt my body. There are after effects, there are side effects. So yes, I definitely one of these days will do a show just on stress and pressure and cortisol and what it does for your body and to your body, excuse me. And one of the things, I love laughter. And people are always asking me, how do you look so young? How do you look so young? Why do you stay so young? I laugh a lot. I mean, my friends and family will tell you, I have a very, I don't want to say strange sense of humor, but kind of open sense of humor. I don't like the people hurting themselves sense of humor. That's not, it's not funny to me. I think because I'm in this whole like healing the body thing. So I'm like, how could you just do that? You know, that's where my mind goes. So that's not funny to me, but a lot of things are funny. And so I laugh a lot and I encourage laughter. And when my team and I are working and I see that we're getting into like this really heavy,
too serious,
we're all getting like super heavy, I'll start cracking jokes. I also know that sitting for long periods of time isn't good for you. And because we're all at our computers all of the time, I do also encourage getting up, stretching, breathing, you know, a lot of things that you wouldn't normally see in the workplace, we do in my workplace. And it's just to keep everybody stress-free, healthy. When I notice there's one of my team members, actually my son, who starts holding his breath, and I'll start seeing it, and I see his little energy change, and I'll go to him and say, breathe. You know, he's like, oh, I'm working on this email. Breathe. You know, you're not breathing and you're holding in something, and that doesn't need to be in your body. So, So, and I do it with the other people, my other team members too. So you do the same?
Yeah. When I'm at work, I personally encourage both my assistant and myself to get up, walk around as much as possible. And I'll often do things standing up. Actually, as much as possible.
That's great.
So that I'm not sitting.
That's great. Yeah.
But when you said sitting, I immediately was thinking, sitting as in meditating. Because I think of sitting, I sit, I meditate also. But it's really important to sit as little as possible. It's also here in LA, we're stuck on the freeway a lot sitting.
Oh my gosh.
So I try as much as I can. I'm always telling my patients, park as far away as you can whenever you're parking, to force yourself to walk. Take the stairs instead of the elevator. Just do what you can to move, to constantly move.
If I'm in the car more than an hour, when I get out of the car, I stretch before I start walking. I just stretch. You can feel those muscles and, you know, especially if I'm in the car and some crazy traffic situation happens, which is normal in Los Angeles, I put on the radio and I just start singing. And I go,
relax.
Whatever. And then I look at my GPS, and if it said an hour, now it's an hour and a half. I just, you know, I'll send a dictation text, not an actual text, and I'll just be talking on the phone, then press send. Be like, okay, GPS now says whatever, I'm going to be late, stuck in traffic, and then just go, la 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 la, the rest of the time. I don't want those stress levels to get to me, so I try to combat them as much as possible. But knowing myself and knowing what affects me, you know, trying to practice that mindfulness part of me and who I am, and what bothers me and what doesn't, and how can I fix it, kind of thing.
I try to tune in on that same vein to my breath. And one of my meditation teachers, who grew up in LA, but he lives elsewhere now, says when he comes to LA, he says, the traffic doesn't bother me. I just focus on my breath whenever I'm stuck in traffic.
That's great. That's really great. What advice would you give to someone who's sick, but they only want to treat the symptoms and not the root?
Well, actually, that's about 90% of my patients.
Okay.
You know, my career's changed a lot. Over the last 5 years, what I do in natural medicine has become pretty mainstream.
Okay.
Prior to that, my previous 25 plus years, I was seeing people who wanted more of a holistic approach. But because it's become more mainstream and most people come now on their health insurance,
Okay.
they're just coming to me for that problem that they just saw their medical doctor for.
Okay.
And they don't really know what holistic treatment means.
Yeah.
So I start with them on treating the neck pain, treating the back pain, the asthma, the PMS, the menopause, whatever.
Right.
And then once we begin to make headway on those symptoms, I try to discuss with them some of the deeper ramifications of the treatment.
Yep.
And let's say we start off at once or twice a week. After the problem's gone, I'm like, well, come in once a month for a tune-up, because we can get to the cause on a deeper level of where that imbalance was, so it doesn't keep coming back each time you get stressed out. Because that's where it's really at, is the prevention, to get into the core of what's really going on.
Exactly.
The other thing is I really believe in Western medicine from the point of view of diagnostics. They have great diagnostic tools.
Yeah.
So I do complete blood work on people, and saliva and urine and hair analysis. So we can see physiologically where those imbalances are, because there's a fine line between emotions and neurotransmitters in the brain and what your phosphorus and sodium and calcium levels are in the blood.
Yep.
And I can look at it all and put it all together on an emotional and a spiritual level as well.
Okay. That's amazing. Yeah. I've not heard of that before. Usually when I go every year to go get a full physical, because I think it's important, and usually it's like, oh, you've got to take your B12 again, or you've got to that kind of situation, but not what you do. So I think that's really amazing. Where are you located?
I have 3 offices.
Okay.
City of Valencia, Santa Monica, and Encino.
Wow.
And I've been in those 3 locations for many years, different days at each location.
Wow. You're kind of really spread out. Is that so?
All close to the 405 or the 5 in Valencia.
That's amazing.
Yeah.
But why?
People wanted to see me in different areas.
Okay.
So I just opened up new offices as I went along.
That's great.
And it just kind of grew to where my clientele now is in those 3 places.
Right.
And people just know which days I'm in which location.
Yeah.
And many people go to 2 or 3 different offices because they may work in one area and live in another area.
Yeah.
So they're very happy. I have a woman who was seeing me in my Santa Monica office, whose office just moved to the Valley, and now she's going to see me in Encino before her drive home on the 405 to Santa Monica.
Perfect. That's
So,
perfect. Yeah, I go into the city 2 days a week, and that's it.
Yeah, that's good.
Yeah, I don't. The freeway is just, it's, I sing, but I don't like to sit.
Yeah.
That's my thing. It's the sitting thing now that bothers me a lot. So, in your opinion, because we spoke about this just a little bit before we started the show, but in your opinion, what are the biggest problems with superficial healing?
Well, most people only know superficial because they're focused on the physical.
Right.
But the problem is if you just treat the tip of the iceberg, which is the superficial, you're ignoring everything underneath.
Right.
And it's the base of the iceberg that's causing the tip to stick out.
Right.
So it's just going to come back if you cut the tip off. Or as I tell people, when you're cleaning your house, do you really clean it and vacuum everything, or do you just brush the dirt under the sofa to pile up? Because it's just going to blow back out and get dusty elsewhere.
Right.
So if you're only doing that little tip, that iceberg, tip of the iceberg, or the superficial, it's just going to come back. Yeah. You got to get to the base of what's actually going on.
Yes.
Otherwise, you'll be left with it over and over and over and over and over.
And I know that that's real healing.
Right.
Getting to the base, digging the root out.
Right.
getting the healing done, and then you don't face it anymore.
Right.
As opposed to the superficial healing where you do a little bit and then you still feel ill, and then you do a little bit and you still feel ill. I think my purpose, my intent with doing these shows and talking to different health and healing practitioners is for really people to understand their illness, and that they have to keep going. You know, go until your medical practitioner tells you you're done.
Yeah.
Go, and then you won't feel it anymore. And it's not going to come back, because once you address the root cause, and you know what that is, and you've worked on it, and you've worked it out, and you've gotten rid of it, then you don't have it anymore.
Right.
And that takes a little bit of time. Don't get frustrated with yourself. Don't get sad. Don't get mad at your health and healing practitioner. Like, really open up and really listen. Listen to what they're telling you. Listen to what's going, and then listen to what's going on within you. Sometimes, and I have to say this, sometimes you're at level 8, pain-wise, suffering-wise. And then you go to your health and healing practitioner, and you may go to level 9, because now you have to open up. And it is. Exactly. It's coming up, like you're crying. Like me having to face my fear with acupuncture. But then once you hit that 9 and you let it all go, okay? Let that root dig out, let it go. Then you'll come down to 1.
Right.
Then you'll go to 0.
Right. And
then it'll be gone. And isn't that what we're after?
Right, right. And I also tell my patients, I'm a big organic gardener. So organic gardening, we don't spray pesticides to get rid of the aphids and the bugs.
Right.
Instead, we apply compost and organic fertilizers to the soil. We build up from the roots up, so that we're cleaning out and detoxing and strengthening the organism, the plant, the person, so that they can withstand the stress better. And deal with everything on a deeper level.
Yeah. I think it's important that people learn that healing can be complete. You know? And that's what a lot of us are here for. I know some people like to have repeat business, so to speak, and again, open up to your health and healing practitioner. Learn them.
Yeah.
You know? Really have a relationship with them. It's important. I believe it's important.
Yeah. I'll often ask my patient, what do you think is going on? They'll say, well, I told you last week I have a neck pain. Yeah. And I'll say, but what do you think is going on? Because it is a teamwork approach. And in my book, I talk about helping the patient to develop their own inner guide or inner healer.
The optimal health?
Yeah.
But, okay.
Yeah, optimal health, how to get it, how to keep it. Because if one gets in touch with their own intuitive aspect, that's their own inner healer. And they can come in to me with a dream or an insight, and that will take me in a different direction. I might treat a different meridian, might treat the spleen meridian instead of the liver meridian, based on a dream that they just told me they had.
Bravo. Yeah. It all matters.
Yeah.
What's going on completely matters. That matters to us. I wrote an article a while back called The Lotus Flower. And so I'm really curious, because you wrote a book called No Mud, No Lotus. And so what's the book about?
It's about how to heal on a deeper level. Exactly what we've been talking about. So the lotus flower grows in this yucky, mucky mud of the pond. And it wouldn't sprout this beautiful lotus without all of that mud.
Right.
So it's based on the fact that without getting in touch with the yucky, muddy parts of ourselves, we can't really sprout this beautiful lotus and sprout into health. We need to get in touch with the shadow work, as Carl Jung talks about, the deeper parts, the parts that are often difficult and painful.
Yeah. And sometimes they are painful, but again, I think understanding where they come from, understanding how they affected you. Just because something affected you doesn't mean you have to let it affect you the rest of your life.
Right.
And a lot of people don't understand that. There are no tools to teach them how to not let it affect them, or to teach them, hey, I don't have to let this situation that I had as a child cause me stress to where now I'm 40 and my body doesn't work anymore, or it's not working optimally.
Right.
So, and also, I want to talk about this with you. Sometimes people get to a point where they're in pain, they're dealing with the situation, and they're in pain, and they just decide to deal with that.
Mm-hmm.
Do you come across that?
Yeah.
And how do you deal with that?
It's difficult. It's difficult. I had an elderly female patient today who has a chronic knee problem. And it's basically, she has no cartilage left in the knee, and it's bone on bone. And her doctors said, try acupuncture.
Okay.
And my ideal is to do acupuncture, which does help with the pain.
Yes.
But in Chinese medicine, the knees have to do with the kidneys and the emotion of fear.
Yeah.
So ideally, I'd want to deal with that. But this particular patient, I don't know how much headway we're going to make. Some people are more closed, more open. So I'm flexible. I discussed with her today. Actually, one of her biggest fears is getting a knee replacement.
Oh, see?
So sometimes
the
surgery is needed. So we do all we can do from a holistic point of view. But if the surgery or the drugs are needed, that's a truly integrative approach.
Right.
Western medicine is part of the yin and the yang.
Yes, it is. And I always say, because my family background is they're very Western medicine, and so when I was growing up, it was always take a pill, take a pill, take a pill. But we're also Native American, and so I also grew up understanding herbs and what herbs can do. Now I didn't learn them, and that's just honest. As a kid, I didn't learn them. My grandfather, and I love this because you do organic gardening. My grandfather, I grew up in Houston, Texas, and so there's mosquitoes, there's roaches, there are bugs. There are bugs everywhere, but I feel like in Houston it was worse. So every year he would, in springtime, right before spring hit, he would make in his kitchen this huge, big pot of herbal stuff, and I don't know what was in there, and I wish as a kid I was more curious and had learned it, and that's my shame on me.
Yeah.
And so he would make this big pot, and then he would put it in one of those, those old-fashioned sprayers that you pour in, then you walk around with this can and go, pss, 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 pss. Yeah. So he'd put it in one of those, and he would go to everybody, all his kids, because he had 13 kids, and he'd go to everybody's house who had a yard, and he would spray all of that, and we had no bugs, no ticks. We all had dogs or cats, no ticks, no fleas, nothing. And our neighbors would suffer, but we always were free of that. And I think that again, knowing Western men and growing up saying, take a pill, take a pill, take a pill. And then as I got older and once I was introduced to the acupuncture, that's when I was like, oh.
And there are Chinese herbs. Chinese herbs is the main thing I know.
Yeah.
So because Chinese herbs is the main thing I know, I know that for almost any kind of pill in Western medicine, there's Chinese herbal, natural pharmaceutical products that will do pretty much the same thing. And a lot of drugs are derivatives of herbs and botanicals.
Yeah. How do you feel about side effects with Western drugs? Because Chinese herbs with the acupuncture, they gave me both. And I no longer have asthma.
Right. Well, that is one of the primary problems with drugs. And it's interesting because I'd say the average person who comes to me is on a few drugs.
Some kind of drug.
And they have symptoms. And I'll say, have you read the insert from the box?
Right.
Go online and Google that drug, because the symptoms you're having aren't really your symptoms.
Right.
They're side effects of the drugs.
Right. Yeah.
So that's part of the big problem. But above and beyond the side effects is if you look at the side effects, you can categorize them by body system. So you can say this drug causes toxicity in the liver or the lungs or the kidneys.
Right.
So we can target, okay, we need to detox the liver, the lungs, or the kidneys
Right.
if you're going to continue on those drugs,
Right.
which sometimes people have to.
Yeah.
So we can do detox. One of my patients has cancer.
Okay.
And she's on chemo right now.
Okay.
So I was visiting her yesterday at home and telling her which homeopathic remedy she could take to detox during her chemo regimen.
Right, right. And how'd she take it?
Well, she was asking me. She's very holistic.
Oh, okay, okay.
She happens to be a yoga teacher and
good.
vegetarian and very into everything holistic.
Yeah.
So she's like, please tell me which homeopathic remedies I can take.
Right.
Because I have to start the chemo next week.
Because sometimes people come to me looking for information, but they're very Western medicine-based mentality. And so, and the reason I kind of made a face when I said it is it's like they come to me looking for answers, but then they don't want to receive the information because I'm not telling them to take a pill.
Right.
There's no prescription I can prescribe.
Right.
I can talk about herbs. I can talk about an acupuncturist you can go see and get Chinese herbs, but I can't prescribe medication. So, and I more than acetaminophen usually don't take. I've had several surgeries where they try to give me Vicodin, and I wouldn't take it. I just deal with it. I just breathe through the pain.
Yeah, and there's great herbal pain relievers that work almost just as well as the drugs.
Yeah, I had thoracic outlet syndrome some months back. And so the MD wanted to give me gabapentin, but because I know that there are side effects.
And it's very hard to get off of that drug.
I know there are side. So see, I know I've studied medications. It's not that I can't prescribe. It's not just that I can't prescribe them. I've studied them. I know what they do to the body. I know because I had asthma. I had 25 years of that medication,
medications,
Yes, it was Tedrol. Look up Tedrol, what Tedrol used to be, and you'll go, okay, now I know why. I had kidney problems, liver problems, I had heart problems. I had 5 EKGs in 1 year.
Right.
Yeah, and that was when my doctor was like, enough is enough. Come do acupuncture, you know? So reading all this, like you said, read the insert.
Before you take it.
Yeah, you'll see. And so with the gabapentin, I asked the doctor, what are the side effects? And he said to me, oh, it's just going to make you a little dizzy.
Right. No.
Take it before bed. It'll make you a little dizzy. And so I was like, okay, gabapentin causes ataxia. That's the dizziness that you want me to go through? No, I don't. I refuse. So I dealt with that whole and went through all the process of the healing and all the exercises and all the pain and suffering, but I dealt with it until it was done, and now it's done.
Some of my patients get angry at the doctors for not having explained the side effects. And I say, you know, it's not really your medical doctor's fault. They didn't study holistic medicine. They're just giving you what they learned.
Exactly.
That's why you need to go to alternative and complementary practitioners at the same time, so that you're getting both points of view. And
just, I think knowledge is power. And so, like you said, read the insert. If they're giving it to you, just take a little bit of time. It doesn't take that much time.
The problem in our culture is everybody wants a really fast solution to things.
A quick fix.
That's probably the biggest problem. And with health-related problems, it's not always a quick fix.
No. A lot of it, again, is root-based. And so you have to figure out the root.
You have to get down to the core level.
And that takes time.
Right.
It takes time. And some of, you know, and I know my viewers have heard this from me before, but sometimes people say, oh my God, but it took me 42 years to get this way. You know, is it going to take me 42 years? No. But do some work. Just put in the work, and I promise you, you can get out of it. I promise you, there is healing there.
On the other end,
Yeah, absolutely.
But they have to be willing to make changes. A lot of my patients don't want to change diet, for instance.
Really?
Yeah. Or I say, you know, you really need to start exercising. And they're like, oh, well, I work hard and da 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 da. And, you know, diet and exercise are pretty much two of the things that we can take control of that can go far and wide to helping the healing process.
Yeah. And also with the exercise, I give suggestions because I also say exercise, but not every exercise is right for everybody.
Exactly.
And so sometimes people go, oh, but I can't run. I hate running. Okay, then don't run.
Right.
Go do yoga.
Right.
Swim. Play tennis. I mean, find what's right. Again, know you and find what's right for you.
Yeah.
Find that thing that makes you happy, because the actual physical exercise will start pumping endorphins in your body, and endorphins feel good.
Right. Which then has a spin-off, and they're more willing to exercise and change the diet.
Exactly.
Yeah.
So just get it going.
Right.
And again, know you. Try a few things. Maybe a friend of mine suggested, let's go belly dancing. I'm like, okay, maybe. I don't think my body will do that, but I may surprise myself. You know, just figure you out a bit. Take some time. We take time to work. We take time to do chores. We take time to...
But we take the body for granted.
Right.
That it should function.
Yeah.
And if you think of it, I mean, the body is as complex as the universe is.
It is.
And getting to know it on a spiritual, emotional, intellectual, and physical level that's 50% of the healing.
Right.
Just getting to know one's own organism and how it works.
Yeah. And I think instead of making it, because in my early years, I used to tell people, I'm the great encourager. So I would tell people, make it your job to know your body.
Yeah.
You know? And then I think people put too much emphasis on job, hard work, pain and suffering, or stress, not pain and suffering, but stress, job stress. So I started telling people, just instead of making it a job, like make it a happiness.
Yeah.
To know your body. Yeah. You know, and just know what it likes, know what it doesn't like, and don't put those thoughts into it either. Oh, I hate running, so I'm never going to do that. Why? Why do you hate running? Is it hard on your ankles? Or do you need to stretch?
Right.
Or I have a friend who, and it drives me crazy, because he'll start exercising, and then 3 or 4 days in, he's like, oh, I don't want to do it. It hurts.
Right.
My body hurts. I can't do it.
Right.
I'm like, okay, but it's going to, because your muscles have not worked.
Yeah.
They're slack.
To be
then they have
expected.
So it's going to hurt for just a bit, but I promise, and I would tell him this, I promise you, just do it for a bit, and then that pain will go away.
Yeah.
Once your muscles build, they'll start feeling great, and then you'll be like, yay, I can go out.
Another tool that I like people to use is journaling.
Okay, yes, me too.
So sit down for 2 minutes in the morning, scan your body, feel the sensations, and jot it down. Yeah. Because usually we just go through the day and ignore the sensations. And the initial sensations are there as little barometers for things that are going to happen later.
Yes.
So pay attention to those on a daily basis.
Yeah.
And if they begin to be irritating, go to a holistic practitioner who can tell you what it means if you have a pain in your knee on the inside versus the outside. Spleen meridian versus the gallbladder meridian. Those have really specific reasons that they're aching and feel painful. And you can deal with them before it creates gallstones.
Yes.
Or some major digestive problem with the spleen or the stomach.
Right. Do you see, because you mentioned gallstones, do you see a rise in gallstone problem in younger people right now?
I see a lot of people with gallstones and the gallbladder having been removed.
Okay.
Yeah. Yeah, I actually had an assistant and who's only 20.
Oh, wow.
Yeah, and another patient with gallstones. It's the stuck energy. Gallbladder has to do with stuck energy rather than the free flow of energy. And the diet that they're eating junk. Yeah. The sugar and the fats creates blockage in the liver, gallbladder area.
Yeah. So yes, energetically there's a problem, but I find in young people today a lot of 20-year-olds in their 20s are losing their gallbladders now.
Yeah.
And I have an issue with that.
Yeah.
You know, and I have an issue with it socially.
Yeah.
Because marketing is telling them to do one thing.
Right.
And as healing practitioners, we're going, no, don't do it.
Yeah.
Well, you don't realize what's going to happen.
You can clean those stones out.
Yeah.
Through different herbal remedies, homeopathy, and acupuncture.
Right.
Yeah. And then I see the same person 10 years later who can't digest any fats and comes to me with a digestive issue. I'm like, yeah, they didn't tell you that if they pulled out your gallbladder, you were going to have trouble later digesting fats, did they?
Yeah, exactly.
Yeah. So then we need to deal with the right supplements to help them break down fats in their body.
Right, right. Yeah, it's just a shame. But hopefully more people will start understanding their body.
Yep.
More people start coming into a place where they're in tune. They're listening. They're journaling, like you said. They're asking themselves the right questions.
Yeah.
Because I always say, this is the only body you get. This is it. You know, I know
Good
people
point.
say, no, because
It's true.
I've had some patients, and I promise you, they're like, oh, you know, if something happens, because I'll warn them, I'm like, oh, something's gonna happen pretty soon now. Oh, I'll just go get a liver transplant or some kidney transplant. What? I'm like, what?
No, you don't really
you don't know
wanna
what
think
that
about
means.
that, right.
You don't know what that means, really. It's not gonna happen like that.
Yeah. It's not a simple thing.
No, it's not a simple thing. And it's, some people who actually get transplants, their body rejects it.
Right. Yeah,
it's not
that
yours.
should never be thought of as the potential solution.
Right.
That's really a last-ditch effort.
Yeah. So this is it. This is all we get.
We were given the body and the organs we've got,
and we have to take care of
should
it.
be taking care of them. Yeah.
Just like we take care of our house.
Yeah.
When our car is broken.
Exactly. Yeah. When the oil warning light goes on, do you put your hand underneath the dash and unscrew the oil warning light? But we do that with our body.
Yeah.
We do that with our body.
Right.
When the oil warning light goes on, and we have migraine headache or whatever, we snuff it off and take a painkiller. Instead of saying, that is the oil warning light.
Yeah.
That's telling us we should look at something.
Right.
It's not a random event that's disconnected from other things.
No.
It means you're out of oil. Or in Chinese medicine, your yin is depleted.
Right.
You need to bolster your yin.
Right, exactly. I feel like, I'm so glad that you were on the show today. I feel very, very good about it. And I feel like you're one of those practitioners who really wants to help your patients. You really have...
It's my life.
I call it motive and intent. You really have the right motive and intent to what you're doing. And it really makes me feel good because people need to trust us.
Mm-hmm. Yeah.
You know? Sometimes we're the last-ditch effort. And
yeah. And I actually say that to some of my patients. Some of my patients, I can tell they have a level of distrust or they're doubting what I'm saying. And I say, you know, the first part of healing is you need to find a practitioner who you resonate with, who you can trust. Yep. That's the baseline. Yep. If you don't feel that, then you should be with someone with whom you do feel that, because you have to have that resonance to be able to work together as a team.
Right. And open up to your health and healing.
Right.
Be honest.
Yeah.
We're not here to judge. Right. I don't judge any. There is nothing, Dr. Martin, that you can tell me that's going to make me judge you. Nothing. Zero. That's not what I'm here for.
Yeah.
I'm here to help and give you the best help that I know how to give you. And if that help even includes you need to go to somebody else so that they can help you, that's my honesty and my trust with you. Yeah. That I, again, am here to help you in the best way possible, and that was the best way I could help you. Some people I can, some people I can't. And because it doesn't resonate. Right. You know? They're like, oh, you're Native American? Can't do it. Oh, you're a woman? Can't do it. And there's no judgment. I'm not going to judge you. It is what it is. Your beliefs are what they believe or what they are. Hopefully the universe will open up. Yeah. At some point and it'll be different, but that's hopefully. but I am here to help you get the best healing that you can get. And so my hope is that people really go to their health and healing practitioner and ask some good questions.
Yeah.
Yeah. Have that relationship.
Yeah.
You know, have the best relationship that you can have with because it's your body, it's your mind. You only get one.
Right.
And you got to take care of it the best way you can. And if you trust your health and healing practitioner, then you're going to be a little bit more open.
Yeah.
Yeah, definitely. Definitely. Well, it has been lovely having you on the show.
It's been
Thank
great.
you so much. Dr. Randy Martin, he is in Valencia, Santa Monica, and in Encino. If you can, are you on Yelp, or can they Yelp you?
Big Yelp. Got a lot of testimonials on Yelp.
Okay.
And the website's www.drrandymartin.com.
Okay, drrandymartin.com. You can reach him through that. Please, when you reach out for a health and healing practitioner, first of all, pay attention to your body. And then when you reach out for a health and healing practitioner, think about what it is that you're looking for in one. Go and have an open, honest conversation. Again, I'm not here to judge you. Most of the health and healing practitioners that I know aren't here to judge you. So there's really, we want the best for you, and that comes through honesty. So if you have any questions for us, please email us at support@exceptionallifeinstitute.com or look at our website at www.exceptionallifeinstitute.com. Have a fabulous, beautiful day, and we'll see you soon.